Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, while doing trabeculectomy, so in the glaucoma, in the surgical treatment of glaucoma, in the trabeculectomy, we use some antimetabolites. Okay, why do you use antimetabolites? Antimetabolites are mainly used in cases where there is high risk of failure of the surgical procedure. When you suspect that there is high risk of failure of this trabeculectomy, then you can use these antimetabolites. Okay, what are the antimetabolites? They are 5-fluorouracil and mitomycin are the antimetabolites which are used when we think of um, failure of surgical treatment of glaucoma, that is trabeculectomy.
thank you and thank you for watching.